Welcome to GBMC. This virtual tour will provide information for families planning to deliver at GBMC. When you come through the main gates of the hospital on Charles Street, you will bear to the left and follow the signs towards the emergency department. The OB maternity entrance will be the second entrance on the right. Valet service is available Monday through Friday from 7 a.m. to 8:30 p.m. at the OB entrance, with the exception of holidays and inclement weather. Keys will be with the OB security after 8:30 p.m. There is a $5 cash fee for valet parking. If you don't want to use the valet parking service, pull to the top of the drive, put your flashers on, and help Mom come inside. Do not wait any longer than 10 minutes before moving your car up the hill to the Lillie Park garage. This is the closest parking garage to the OB entrance. The fastest way to get back to the OB entrance from the garage is simply to cross the road and follow the sidewalk back down and around to the entrance. The entire second floor of the hospital is dedicated to obstetrics. It is a locked-down, secured environment with keycard access only to labor and delivery and postpartum units. The Parent Connection office is located in the OB atrium and is open to patients and visitors. There is a lactation lounge for parents to feed their babies. A beautiful boutique with nursing bras, care items for mom and baby, as well as adorable gift options. GBMC hosts many parent education classes here as well, such as preparation for childbirth, breastfeeding, infant care, infant CPR, and cesarean preparation. Yoga classes are available here as well as support groups for moms before and after delivery. Parents can also schedule private lactation consultations, and hospital-grade breast pumps rentals are available. Information about the Parent Connection can be found on the gbmc.org website. When expectant parents arrive, they should go to the OB admitting desk. Some doctors pre-register their patients, and their information will already be in our database. If parents are not sure if they are pre-registered, they can contact their doctor's office to confirm or check in person at the OB admitting desk. If they are not registered, an online pre-registration form is located on the GBMC website. All visitors will be expected to show photo ID at the security desk located in the OB atrium. Partners will be asked for photo ID, which will be kept while they are here. The partner will be given a key card to access labor and delivery. When the expectant couple's visitors arrive, they too will be asked for photo ID and will receive a visitor's badge. Partners will be responsible for escorting their visitors onto the labor and delivery unit and out again. For detailed information regarding the current GBMC visitor policy, please see our website at gbmc.org. After Mom is checked in, the OB admitting staff will ask her to wait in the atrium. A nurse will come to take Mom and her partner back to an assessment triage room or to a labor and delivery room for a scheduled procedure. We have 4 assessment rooms. One visitor is allowed in the room with Mom. A nurse will take Mom's vitals and put bands on Mom's stomach, one for baby's heartbeat and one for Mom's contraction pattern. At some point, your doctor, midwife, nurse practitioner will most likely perform an internal exam. If Mom's labor pattern is still in the early phase, she may be asked to leave labor and delivery and walk around the hospital, or even return home until the labor pattern has progressed to a more active stage. When it is determined that Mom is in active labor and/or ready to be admitted, then the nurse will take Mom to one of our 17 birthing rooms. Once in your labor room, patients are encouraged to make themselves comfortable. They can adjust their own thermostat, lighting, and shades. Each room has a flat-screen TV and telephone. You may wish to bring a favorite pillow from home, a music player, a plug-in scent diffuser, or even battery-operated candles. Each room has its own private bathroom with shower. If approved by the patient's physician, the nurse can also bring in a birthing ball, rocking chair, or birth bar. All in-room monitors are also centrally monitored at the nurse's station, so even if the doctor or nurse is not in the room, they can see how mom and baby are doing. There are 2 nourishment rooms in labor and delivery equipped with a microwave, full-size refrigerator, and ice machine. All laboring mothers will be restricted to a clear fluids diet. Apple juice, cranberry juice, ginger ale, and popsicles are available through your nurse. Other clear liquids such as Gatorade, coconut water, tea, and broth may be brought from home. Be sure to label any food you store in the refrigerator with your name, room number, and the date. Food left in the refrigerator will be periodically purged. When it is time for your baby to be born, the bed converts to a delivery bed. With the push of a button, the doctor can activate the surgical lights that are recessed in the ceiling. A large mirror is available for mom if she would like to see her baby being born. Labor positioning and delivery positions will be discussed with your obstetrical care team and approved by your obstetrician. At birth, we will make every effort for immediate skin-to-skin contact with mom or her partner unless your baby needs more direct initial care. At some point, your baby will go to the warmer for basic assessment, including weight, a vitamin K shot, and antibiotic eye ointment. If the baby's condition is stable, they will stay in the birthing room with mom and her partner for about 2 hours after birth until the family moves together to the postpartum unit. If your baby needs additional attention after birth, then your partner can accompany the baby to the NICU, which is located on the 3rd floor. GBMC has a level 3 NICU with 13 family-centered rooms. Each mother and partner's ID bracelets allow them access to the NICU. There are 3 prep rooms for our cesarean section patients. For a scheduled cesarean, mom and her support person will be instructed to arrive at least 2 hours prior to the scheduled surgery. Once mom has been assessed and all questions have been answered by her medical team, she will be escorted by a nurse into the OR where the anesthesiologist will begin the anesthesia and the delivery team will prepare for the surgery. Her partner will be given full scrubs to put on in the prep room and then be escorted separately to the recovery room hallway where he or she will wait for mom to be prepped for surgery. Once the team is ready to begin the surgery, the partner will be escorted into the OR and seated next to mom. Pictures may be taken after the delivery, but not of the surgery. Pictures should be of the baby only and not staff unless permission has been granted. If everything is stable with the baby after birth, then the partner will be invited by the nurse to come over to the warmer to meet the baby and take more pictures. Then mom, baby, and partner will have a few minutes together in the OR before the partner will take the baby across the hall to the recovery area. Mom will join the partner and baby in the recovery room once surgery is complete. The family will be in recovery for about 2 hours after the birth until they are transferred to the postpartum unit. We have 48 rooms in the postpartum unit. The postpartum rooms are decorated to look a little more like home and also have a television, phone, and Wi-Fi available. Every room is private and has a private bathroom. Mom does not need to bring a hairdryer. One is provided for her, along with a lighted makeup mirror and a heat lamp. Breast pumps are also available in each room should mom need it. Moms will typically stay for 2 days following a vaginal delivery and between 2 to 4 days after a surgical delivery. Their obstetrician may decide to adjust these guidelines if necessary. GBMC allows 24 hours rooming in for baby. All breastfeeding moms will be visited in postpartum by a lactation specialist to answer questions and address any breastfeeding concerns. If the lactation specialist feels a hospital-grade breast pump would assist mom's breastfeeding goals, they will arrange for this prior to discharge. The car seat carrier will be brought in on the day of discharge, and the nursing staff will observe the baby's securement in the carrier. To verify proper installation of your car seat, please visit the Kids and Safety Seat program on the maryland.gov website. We thank you for choosing GBMC for your care during this very special time in your lives. If you have further questions, please contact our Parent Connection office. We look forward to seeing you soon.